දැන් මේක දීලා තියෙනවා.
Welcome back, ladies and gentlemen. We are delighted to begin the next session in today's program, the thematic presentations, featuring a distinguished lineup of speakers here at PeMSARC' 2025.
Before we commence this session, we would like to remind the speakers of the following. Each speaker will have 15 minutes to present their research. There will be one bell ring at the end of 12 minutes and 2 bell rings at the end of 15 minutes. Mr. Indura Jayatilaka will be joining as the timer.
Without much further ado, we would like to invite Professor S.T. Kudagammana from the Department of Pediatrics, Faculty of Medicine, University of Peradeniya, to deliver his presentation on the burden of recurrent wheezing and allergic disorders in children in Sri Lanka.
Morning. The invitees, my dear colleagues, and other distinguished guests arrived here, and my dear students and ladies and gentlemen. I consider this my privilege to talk to you on this special occasion, and I thank the chairperson and the organizing committee of PeMSARC for giving me this opportunity. Childhood allergic diseases are a very common group of clinical entities. The most liberal estimates quote the prevalence of these diseases to be as high as around 20% of all children. Bronchial asthma, which is frequently seen childhood allergic disease, is perhaps the most common chronic disease in childhood as well. Other allergic diseases include allergic conjunctivitis, eczema, food allergies, drug allergies, and chronic urticaria. This talk is an attempt to highlight my contributions towards a concerted effort in trying to understand pediatric allergic diseases in children of Sri Lanka, with a special emphasis on wheezing disorders and in a quest towards improving the management of those affected. Etiology of allergic diseases. Why some children develop allergies while others do not is not clearly understood. The current understanding is that a child who is genetically predisposed when exposed to the triggering environmental factors could go on to develop allergic diseases. Many studies have attempted to evaluate the genetic basis of asthma and allergic diseases. The largest and the most comprehensive study of asthma genetics to date was conducted in 2010 by a consortium of more than 100 centers worldwide. They ran a genome-wide assay which genotyped 10,000 odd persons with asthma. Among many genes associated with asthma, ORMDL3 gene in particular was associated with childhood onset asthma. A family history of asthma and atopy is an important risk factor in asthma and allergic diseases. Interestingly, when the mother has asthma, the risk is higher than when the father has asthma, a proven fact elucidated time and time again. Environmental factors and allergic diseases. There are many established etiological factors for allergic diseases in children. Their significance in different communities has been shown to be variable. Antenatal and early postnatal exposure to smoke is associated with asthma and allergies. Exposure to chemicals and pollutants has been debated over the years as a causative factor in these conditions. Some studies have shown that children living in polluted environments have a high risk of allergies, while others have shown the results to the contrary. The explanation for the studies showing the latter may be due to the chemicals triggering asthma and other allergies, while the former explains the clean environments causing more allergies, that is the basis for the hygiene hypothesis. In order to explore the different possibilities, we conducted a study on preschool children in two estates, one using traditional methods of tea cultivation using agrochemicals as well as chemical fertilizer, and the other using organic methods of farming, both types of cultivations being in place for the last 25 years. As we all know, children living in tea estates are very closely exposed to the effects of the environment due to their behavior and living within the estate itself. Data from 81 preschool children from the organic estate, that is Haputale, and 101 preschool children from the conventional estate were analyzed. The difference in prevalence of wheezing and allergic rhinitis was statistically significant at p less than 0.05. We concluded that allergic conditions were more common in preschool children with environment exposure to agrochemicals and chemical fertilizers when compared to that of organic cultivation systems. The findings of this study were presented at the International Congress of Pediatric Pulmonology in Krakow in Poland in 2015. The findings were published in the Journal of Allergy, Asthma and Clinical Immunology in the year 2018. Ladies and gentlemen, Being a country with an agriculture-based economy, a significant proportion of the families of Sri Lanka are closely involved with agriculture. It is our obligation to determine the effects of the different practices of agriculture on health of children. We studied the incidence of asthma and allergic diseases in a group of preschool children growing in standard home gardens using a mixture of traditional methods of farming as well as using chemicals and others in improved home gardens using improved methods of farming without chemicals. The study was conducted in a remote village in Nawalapitiya in the central province of Sri Lanka. This was part of an extensive multidisciplinary study which included 3 specialties, one studying plant diversity, the nutritional intake of the children, and the preschool diseases including allergic diseases. The study was funded by Nestle Foundation Switzerland and included research teams from Faculty of Agriculture and Faculty of Medicine Peradeniya, ETH University Switzerland, and University of Weinberg. 2 groups of families, including 19 preschool children in each group, were followed up for a period of 18 months. Though the results showed that the incidence of allergic disease among the preschool children was not different in the 2 groups over the study period, it showed that nutrition amongst children was markedly improved by the intervention. The overall findings of the study were published in the journal Frontiers in Sustainable Food Systems Nutrition in 2019. Let me now take you on some further deliberations on the common allergic diseases such as asthma, allergic rhinitis, and eczema. Epidemiology of allergic diseases. Understanding the epidemiology of any disease condition is a first step in planning improvements in care. This is clearly the case in pediatric allergic diseases, where there is significant differences in characteristics of allergic diseases among different geographic regions. The epidemiology of pediatric allergic diseases cannot be discussed without mentioning the International Study of Asthma and Allergies in Childhood, that is ISAC study research initiative. It is the largest of all epidemiological studies involving 100 countries and nearly 2 million children to assess the prevalence and risk factors of pediatric allergic conditions worldwide. The ISAC program was formally closed down in December 2012. After that, the Global Asthma Network, GAN, was initiated in 2012, and it extended and continued the work of ISAC in the field of allergic diseases. The network is a collaborative effort between individuals from ISAC and the International Union Against Tuberculosis and Lung Disease. As country collaborators of GAN, I, along with Dr. Jagat Ranasinghe, who is now the consultant pediatrician at Nawalapitiya, conducted a study among school children in Kandy and in Anuradhapura in September to November 2018. We used the translated and validated ISAC questionnaire for the 6 to 7-year-olds and 13 to 14-year-old children. The study was funded through a research grant from the University of Peradeniya. A total of 3,600 children of 6 to 7 years and 4,600 children of 13 to 14 years were recruited. The prevalence of current asthma was 12% among 6 to 7-year-olds and 15% in the 13 to 14-year-olds. The reported prevalence rates of the disease conditions were 9.9 and 10.1 in the 6 to 7 years and 14 point in the Anuradhapura district. When comparing these prevalence rates, there is relatively higher prevalence of childhood allergic diseases in the Kandy district. This difference is statistically significant in all 3 allergic disease conditions with p less than 0.01. It was presented at the International Congress of Pediatric Pulmonology in Nice in France. The findings were also highlighted in the paper published by us in the Journal of Allergy, Asthma and Clinical Immunology in the year 2022. The well-scrutinized Sri Lankan data were shared with GAN study group. These were included in the widely cited article published in the Journal of Clinical Medicine. With this study, ladies and gentlemen, we were able to bring our country into the world map of the prevalence of allergic diseases in the world for the very first time. Management of allergic diseases. Management of allergic diseases includes avoidance of allergens and appropriate use of pharmacotherapy. In the management of asthma, pharmacotherapy is generally categorized as preventers and relievers. The state funds most of these medications for patients, but there are significant supply chain disruptions of these medications. Most of the patients are unable to afford these if they are required to buy these by their own funds. This suggests that the medications might not be available to all deserving pediatric patients, resulting in inadequate control. This hypothesis was tested by an international study with the participant country collaborators of GAN, including Sri Lanka, represented by us. A validated written questionnaire was distributed among schools with 3 age groups, that is 6 to 7-year-olds, adolescents, and adults, that is more than 19 years. In individuals with asthma diagnosed by a doctor, we collated responses on past year asthma medicine usage. Questions on asthma symptoms and health visits were used to define past year symptom severity and extent of asthma control. Overall, 450,000 individuals from 63 centers in 25 countries were included, comprising 101,000 children, with 6.3 of them diagnosed by doctors having asthma and 150,000 adolescents. The proportion of individuals with severe asthma symptoms not taking inhaled corticosteroids was high in both age groups, that is 44% in young children and 60% in adolescents, and was significantly higher in middle to lower income countries like ours. Poor asthma control was associated with low country income and in countries including Sri Lanka versus high income countries, with adjusted odds ratio of 2.3 for younger children and 3.4 for adolescents. The findings of this study highlighted the fact that asthma management and control is frequently inadequate, particularly in low resource settings like Sri Lanka. The findings were published in the journal Lancet Global Health in 2023. The study highlighted the fact that affordable and practical clinical standards are needed in the management of asthma in lower and middle income countries like Sri Lanka. In order to achieve this objective, a panel of 69 experts from 31 countries in the field of asthma in lower middle income countries were identified with the Global Asthma Network. All respondents were asked to comment via a Delphi process on several draft standards developed by a core team of 14 researchers. Based on agreement at multiple rounds, a draft document was developed by the expert panel. The document underwent multiple rounds of revisions, and the final version was approved by consensus. Finally, 18 standards were laid down and were published in the International Journal of Tuberculosis and Lung Disease in 2023. The commonly used drugs in allergic diseases include local and systemic steroids and antihistamines. We were intrigued by the question, can the medication given at optimal time of the day give rise to better efficacy with lesser side effects? Many physiological functions of human body, including food digestion, blood circulation, and hormone excretion, have cyclical patterns in a given day. Light and darkness in the environment have a great impact on the human body and controlled by genetically manifested timers that reside deep within our bodies. Although many drugs have reproducible daily variations, researchers have identified over 100 drugs with significant variations in concentrations or effects both over 24 periods. It is quite an interesting field, and the place of administering anti-allergy medications synchronizing with the biological clock was highlighted in a review article published by us in the Sri Lankan Journal of Child Health in 2012. Conclusions. Ladies and gentlemen, the incidence of allergic diseases in children is high and is increasing in many countries in Southeast Asia with significant differences in different geographic regions. Many studies worldwide have shown that there are significant numbers of patients with undiagnosed and uncontrolled diseases, which have been proven to be the case in Sri Lanka as well. Early diagnosis and appropriate treatment are the need of the hour. A regular screening program covering the entire nation should be put in place to detect them and then provide the best possible management strategies. Simple, practical, but up-to-date management of allergic diseases, including basic diagnostics, should be made available to all patients in this country. We have highlighted our humble contributions in our efforts towards understanding some of the important aspects of pediatric allergic diseases, with a special emphasis on wheezing disorders relevant to our country and some of the management strategies for effective management. Thank you, ladies and gentlemen, for your patient listening.
Thank you, sir. We kindly request you to please remain on stage to receive your certificate. We cordially invite Professor Samidhi Navaratna, Conference Chairperson of PeMSARC'25, to award the certificate. Thank you, sir. Thank you, madam. We now invite Professor J.K. Disanayake from the Department of Anatomy to deliver her presentation on anatomical variations in a Sri Lankan population, clinical, forensic, and evolutionary insights.
Thank you. My dear colleagues, my dear students, and the esteemed audience, thank you very much for being here today for these sessions. Today, in this particular aspect, in relation to this thematic research plenary, I would like to bring forward a particular topic which we were kind of doing in a kind of a low phase or in a slow phase, however, not forgetting the importance of that. So basically, when we are talking about anatomy, we cannot forget about anatomical variations, because it has many implications in clinical practice, in areas like forensic science, and also in genetics and in various other fields. So talking about anatomical variations, variations are naturally occurring differences, as you all know. It's in the kind of, maybe if it is a qualitative trait, if you look at it on either sides of the bell-shaped curve. Or in a qualitative trait, it is not within the kind of so-called normal level. Also, the normal trait is also defined by looking at all those variations occurring in particular populations. And the most common one, most commonly occurring variation is taken as the normal one. So when you put the normal thing into another population, maybe it is a variation. So because of that, it is very important to understand these things. So I'm today presenting some of the studies and case reports that we have actually done and published in our department. And also, there were few collaborations though. I will come back to it at the latter part of my presentation. So I'll start with the neurovascular variations, which is very common and also which is very easy to find also. So talking about the neurovascular variations, there are a lot of the arterial variations, venous, and variations related to nerves, which are basically focusing on, we are focusing on the branching patterns and the cause, and in certain instances, their origin. And also, these are actually very critical when it comes to vascular surgeries and other surgical processes and endovascular processes and nerve-related interventions as well. So I will first start with a particular anatomical variation, which we have published in Sri Lanka Journal of Anatomy, which was about the variations of the branching pattern of brachial artery. If you can remember your student days and the students in your dissecting room, you would be dissecting first the upper limb, and you would have come across all these things, but most probably we are very ignorant on those things, just like in the student days we were also like that, but now only we have recognized the importance of that. And to see that there are plenty of variations which are actually not reported also, and our prevalences are not reported. So some of our very enthusiastic pre-interns who were there in 2019, they wanted to work with me, and they looked into this one. Right? And we have seen, we just went through about 54 upper limb specimens to find out about 5.5% showed variations. It is not a small number though. And in relation to that, the types of variations, if you look into, we have seen, you all know that the brachial artery is branching into the ulna and the radial artery, which is usually in the cubital fossa. But however, we have seen many variations, like in other specimens also we have seen, but in this particular cohort, we have seen that there's a high bifurcation occurring in axilla, lower down above the elbow joint, and certain other, even at the normal cubital fossa, there are several other variations. So you can see in this one, there are also, all we have to say that when you are looking at this, in the same body, left and right variations are also there, not the same pattern seen in both sides. So it is unilateral high bifurcation, and that is somewhere in the mid-humerus like we have seen it, and a trifurcation where radial artery, ulnar artery, and the common interosseous artery was originated in the same place. And these are basically clinically important in flap surgeries, coronary bypasses, and intraarterial injections, and because of that, various other procedures. So it is important to understand that it is necessary when you are going for certain procedures, we need some imaging and also requiring some awareness to prevent complications. So related to those things, when you are looking at the radial artery variations, another series which we have looked into in 2024, we have published it, in 28 upper limbs, there were about 14.2 had variations, which is a very high number. And in that, we have seen very significant variations which are important in and having clinical significance. And also related to ulnar artery, in the previous cohort in 2019, which we have looked into, the 54 upper limbs, we have seen 3% 7 showed ulnar artery variations. So these are very important in relation to day-to-day venipuncture is every day happening, and nurses are doing, students are performing, and all the doctors are doing. So they are at risk of damaging these structures, getting into that. So one of the high-risk situation is this, which was published some time back in IPERS, which is a superficial ulnar artery. Superficial ulnar artery is running in the above the superficial, the deep fascia with the vein, so you might confuse this with a vein, and accidentally your intravenous injection may get into this one. And also, not only the upper limb variations, upper limb vasculature we have looked into, we did not study much about the lower limb variations. However, there was one study we have done in relation to medial and lateral circumflex arteries in the upper thigh, which are actually important contributors to the hip joint circulation, and also for the knee joint circulation, and the collaterals related to that area. So in that series, about 27 cadavers we have studied. Bilaterally, we looked into it, and about 16.9% of the lateral circumflex artery and 3.7% of medial circumflex artery has shown variations, which is quite a significant number. And then another study we have looked into, not a study, this is a case report we have looked into, and there was another one also. This is one of them we have published. The other one we have actually presented in a conference, as I can remember. However, I was able to find this one only. The vertebral artery origin. Usually, you know, it is from the first part of the subclavian artery. However, there are occasionally we are seeing these the vertebral artery variations that are, this particular one is arising from the aortic arch. So it is related to the developmental regression of the aortic arches. However, the other important thing that we have seen in not only the origin but also the entrance into the transverse foramina, which is usually at the 6th foramen, but this one is somewhere around the 3rd cervical vertebra. So these ones will be in danger in certain endovascular interventions and aortic arch surgeries. So they are at risk of getting damaged. So iatrogenic injuries are possible. So that is why it is important to do imaging studies to understand the vasculature in these areas, and counting that there will be variations, you will give a kind of a risk-free environment for your patient. And then we have seen several cases, but this was one of the reported ones, related to brachiocephalic trunk, if you can remember, and the left carotid artery. You know, the left carotid artery is arising from the aorta directly, and then the subclavian, right subclavian, and the right carotid has a common trunk called the brachiocephalic trunk, which is arising from the aortic arch, which is in the superior mediastinum. However, in this case, it is true that it is arising from that, but however, it has the kind of a variant course which is going in front of the trachea, and then only it was deviated to the on either sides. So because of that, you can see in the middle of the neck, in front of the trachea, this huge brachiocephalic trunk, and towards the left side, the common carotid artery is there, which is a kind of a very vulnerable position when it comes to procedures like tracheostomies and thyroidectomies and other procedures. It's directly at the neck. So it is very important to understand that, and also this pulsatile mass might mimic an aneurysm there. So we have to understand that these variations can occur, and these are, although rare variations, they are very significant when it comes to clinical practice. And also, coming back to the variations related to the nerves, again, upper limb was our main focus. So we were looking at these brachial plexus variations in different ways. The whole brachial plexus, the median artery, median nerve, ulnar nerve, musculocutaneous nerve. So in various ways we were looking at it, but however, I'm presenting here only a few published ones. This was published recently. 60 upper limbs were studied, and you can see 41%, 6 of the brachial plexus showed variations. So it is very important to understand this. This is a very high amount, and especially there are bilateral variations in the same person. So when it comes to injuries, reconstructions, and when it comes to various other procedures and axillary clearances and various other procedures that are performed in that area, you may encounter accidentally a nerve related, or a root, or a trunk which might get damaged accidentally. So it is important when you're, and especially axilla is a very crowded area also. A lot of neurovascular structures are there. So therefore, we have to be aware of this particular condition. Brachial plexus is a very variable structure. So in that, we have seen a lot of this absent musculocutaneous nerve is also a very common thing that you may see. You may have seen this when you are dissecting the cadavers also, and also these prefix, postfix plexuses are also there. And then comes to the nervous variations, the sciatic nerve. Especially, we have seen in another series a lot of variations there, and you can see some of the, there is a high division, and also going through the piriformis muscle, piriformis syndrome is possible, and then along the course there may be variations. So again, it is another very important thing, and also related to intramuscular injections, we have seen that it is at risk. And then related to another entrapment syndrome related to the suprascapular neurovascular bundle, we have seen in another study that there are a lot of variations in relation to the suprascapular ligaments. Some are going above it, some are going below that, and entrapment syndrome is very at risk of getting entrapment syndromes as well. So in relation to those things, We have looked into the muscular variations also. We have done a lot of studies on this peroneus tertius and extensor digitorum longus. Varuni is the main key person in that one in my department. So we have published a lot of studies, and these are biomechanically, and some more in this one. So that is another area where we have seen a lot of variations, and in other muscles also we do have seen. However, I'm just using this particular one as an example in this place. And also looked into the other various things like Q angle, that is a quadriceps angle. We have done some studies related to their variations. And then comes to the subclavius, which is very important. To rare variations we have seen, subclavius posticus, which is actually going across the thoracic inlet, getting attached to the scapula, causing thoracic inlet syndrome out of about 28, I suppose, 17 cadavers. We have seen 2 subclavius posticus muscles, which are very rare variations, but very commonly seen in our cadavers, which we have not explored after that. And which has shown a lot of venous, in that particular cadaver we have seen venous engorgement and collateral development obstruction signs were seen. And in also, you all know the palmaris longus muscle, which is a very common muscle, which is actually giving us some evidence about evolutionary perspectives. A vestigial muscle, though, which is well developed in tree-dwelling animals, we have seen absence to well-developed muscles in that series. And also we have looked into skeletal variations also, which are very important in sex determination, which has shown in male and female differences very nicely seen in humerus and femur in relation to both qualitative and quantitative features. And also various other skeletal variations we have looked into. So in all these cases, actually, we have seen a lot of anomalies, and a very interesting anomaly I just wanted to show you in relation to this one. This is the internal, inferior mesenteric artery supplying most of the colon, which is very kind of a variation which is surgically very important. So we are going to present this in a Anatomical Society YouTube. We are going to do a session related to that. Hopefully we will communicate with this with everyone. So all these variations finally, and another subhepatic vermiform appendix. So all these things finally you can see that there are variations are very common. Right? So you cannot go over that. That is why we are very important to sort of look into these things in clinical practice, and it is applications are in various areas, like as I have told you, in forensic identification, in describing evolutionary perspectives as well. So it should be a part of the medical curricula as well. That is why we are kind of stressing on sometimes cadaveric dissections. So I just gave you a little glimpse of it. However, we have a lot of limitations related to sample sizes and everything and collaborations. At the moment, we are looking for those things, and we have, if we can overcome these limitations, we can actually do a lot of things in relation to Sri Lankan norms and values and population-based cohorts. Thank you very much.
Thank you, madam. We kindly request you to please remain on stage to receive your certificate. We cordially invite Dr. Sayuri Pereira, the Conference Secretary of PeMSARC 2025, to award the certificate. Thank you very much, madam. We now invite Dr. WJBSMS Jayawardena from the Department of Anatomy to deliver their presentation on multimodal approach to improving the outcomes of patients with preeclampsia.
Good afternoon, everybody. And first, I would like to thank giving me this opportunity to the PeMSARC team. And after listening to very interesting speeches from our seniors, now I am going to present the multimodal approach to improving the outcome of patients with preeclampsia. I'm Dr. Sumujayawardena from Department of Anatomy. Preeclampsia. I think all of you know it's a huge iceberg in clinical medicine. Before moving into discuss about the preeclampsia, first we'll have a look what it is. It's an entity in hypertensive disorders of pregnancy, which includes chronic hypertension, which can be essential or secondary, white coat hypertension, mask hypertension, gestational hypertension, and the time bomb preeclampsia. During the course of pregnancy, around 10% of women develop this high blood pressure. What is hypertension? I'm sure all of you know it, but just to recap, even in pregnancy, hypertension is systolic blood pressure more than or equal 140 millimeters mercury and or diastolic blood pressure more than or equal 90 millimeters mercury. With that, if we get the definition of preeclampsia, it's a hypertension in pregnant women presenting with new onset one or more of the following conditions. They are proteinuria, maternal organ dysfunction, which can be renal, liver, neurological, hematological involvement, or even pulmonary edema, and uteroplacental dysfunction, which can vary from placental abruption to intrauterine fetal death. So, if a pregnant woman is having hypertension associated with one or more of these things, then we are going to diagnose her as having preeclampsia. So, what is the importance or the burden of this? According to World Health Organization, hypertensive disorders of pregnancy are among the top 5 causes of maternal deaths worldwide. And in Sri Lanka, the number 1 cause of maternal deaths is these hypertensive disorders. As you can see in this chart, around quarter of the maternal deaths occur due to these hypertensive disorders of pregnancy, including preeclampsia. So the patient's knowledge on this disease condition, positive attitudes toward the disease, and practices on prevention and management are very important for better outcome. So identifying the gaps in knowledge regarding hypertensive disorders of pregnancy among pregnant women could help to improve maternity care. If we see the global situation on awareness of this disease entity, even in developed countries like USA and developing countries in African continent, in everywhere, they have noted poor knowledge with regard to hypertensive disorders of pregnancy among pregnant women. And also they have noted that low educational level and low income, which was associated with this poor knowledge. So in our multimodal approach, first we thought to explore about this awareness in Sri Lankan situation as well. So for that we chose a pre-tested interviewer administered questionnaire which included demographic information and questions on knowledge which include red flag symptoms of preeclampsia and questions on attitudes and practices related to prevention and management of hypertension. And then the scoring criteria which we used are knowledge score more than 80% we took as good knowledge, and attitude score and practices score more than 50% we have taken as positive attitudes and good practices respectively. The key findings which we got are in this cohort, 42% of them were employed and more than 75% of them were educated above or up to GCE A levels, and around 70% of the population is having a monthly income more than 60,000 rupees per month. The mean knowledge score of this population is 85%, with majority, That means 74% having good knowledge scores. When we inquire about the red flag symptoms of preeclampsia from these patients, sudden swelling of face and limbs, severe pain just below the ribs, problems with vision, and severe headache were noted by more than 80% of the pregnant women as red flag symptoms. Vomiting is the only symptom where many patients thought that it as a normal or a physiological condition even in hypertensive patients. And only 46% of them identified all red flag symptoms of preeclampsia. We noted higher education level and higher monthly income associated with better knowledge scores. As you can see in these graphs, women educated up to about GCA levels had a good knowledge score, around 80% of this population. And again, another 80% of the population with high monthly income has acquired good knowledge scores in there. And we noted 100% of them had positive attitudes towards the disease. But surprisingly, only 22% of this population adhere to good practices. And there were no significant associations identified between demographic factors and attitudes or practices. Our overall findings are, although overall knowledge on hypertensive disorders of pregnancy was good, awareness on red flag symptoms and signs of preeclampsia was poor. And despite having good knowledge on HDP, in more than 2/3 of the population, less than 1/3 adhere to good practices regarding prevention of hypertension. So we would like to recommend from this part of our study to develop targeted health education programs to improve knowledge and practices on HDP, especially on red flag signs and symptoms, and to focus on practical strategies to bridge the gap between positive attitudes and actual practices. And lastly, to address factors for not adhering to good practices. So without stopping there, in our multimodal approach, then we moved off exploring a tool or a test to predict preeclampsia. So for that part, let's have a brief idea about what is the pathophysiology of preeclampsia. There, we discussed two hypotheses related to that. Placental hypothesis, where we discuss abnormal placentation as the key thing in developing preeclampsia, where hypertension and endothelial dysfunction are the key facts. And the newly found hypothesis, the cardiovascular origin hypothesis, where they discuss about cardiac placental axis. There also they discuss about a generalized cardiovascular dysfunction, where endothelial dysfunction play a place. So we thought of using a marker of endothelial dysfunction for our research. There are many serum markers, physiological markers, and scans in finding endothelial dysfunction. But for our study, we have chosen two markers, brachial artery flow-mediated dilation and serum soluble endocrine, as the predictive markers of preeclampsia. And this is carried out for the first time in Sri Lanka, and we are taking pregnant women diagnosed with gestational hypertension for the study in their early 3rd trimester for this. Then we do these two tests, and we are going to follow up them until delivery for preeclampsia. So what is serum soluble endocrine? It's an anti-angiogenic biomarker protein which is cleaved and released into the circulation from the co-receptor endocrine. Endocrine is present in the endothelium, and it is highly expressed in human placental tissues, and it gets elevated in situations of endothelial dysfunction. That's why we are going to use this. And we are going to measure maternal serum endocrine levels using a commercially available ELISA kit in our research population. Then let's move to talk about brachial artery flow-mediated dilation, or FMD. It's a non-invasive radiological test which uses ultrasound techniques to assess endothelial-dependent vasodilation. In here, we use the technique or the method based on usually if there's a ischemia or increasing flow in the arteries, they tend to dilate. It's a normal reaction in a healthy subject. So if there's an endothelial dysfunction, this arterial dilation doesn't occur as in a healthy subject. This is mainly dependent on nitric oxide like vasodilator release, and we use this phenomenon in our test. So this is our lab setting, which is situated in the Department of Radiology, and as you can see there, we have the scan machine and a probe holder. Since this is doing for the first time in Sri Lanka, we had to develop all these gadgets which we need for the technique, from this probe holder to and the pneumatic cuff, and also the software to analyze we had built with several teams of engineers. And if I describe briefly the test which we are going to do, here we place the ultrasound probe at the brachial artery and get a clear image of the artery as shown in this image. And then we start recording the measurements for around 2 to 5 minutes to catch the baseline diameter of the brachial artery. Then we inflate a cuff, a pneumatic cuff, and that will reduce the flow in the arm for nearly 5 minutes, and then we rapidly release the pressure, which will lead to acute flow of the blood. That will cause to dilation of the artery, and then we are going to measure that part also for another 3 to 5 minutes, and we are analyzing it using a software to get the baseline diameter before cuff inflation, and then after cuff inflation and release, we get the peak diameter of that patient. And then using this formula, we are going to calculate the flow-mediated dilation as the % change in the diameters. So what is the novelty and relevance of this? We are going to compare the FMD and serum endocrine levels made between women who progress to preeclampsia and those who do not. And then we are going to explore the utility of these parameters in predicting preeclampsia. Serum tests like serum endocrine and other serum tests are very costly and invasive. So we are assessing correlation between FMD and serum endocrine levels in our test, and we are going to evaluate the possibility of using FMD as a potential non-invasive and low-cost predictive measure of preeclampsia. There, FMD test would be a helpful technique in low and middle income countries like Sri Lanka to predict preeclampsia. By early detection and identification of these patients who are going to get preeclampsia, the healthcare team, especially the obstetricians and neonatologists, and the patient herself will be much prepared, which will definitely minimize the morbidity and mortality of this disease. And all these findings will guide obstetric policy making and to improve clinical practice in Sri Lanka. So I would like to give my special thanks to my supervisors and collaborators, my chief supervisor, Dr. Damsara Nandadeva, Dr. Kirti Disanayaka, Professor Champika Gihan, Professor Shantini Rosairo, Professor Manoj Patirage, Professor Chaturaratnayaka for their support, and all the participants and all the staff in the obstetric clinic at Teaching Hospital Peradeniya. Without all of them, this cannot be succeed. So, thank you very much.
Dear Madam, please remain on stage to receive your certificate. We cordially invite Dr. Tilanka Senaviratna, conference treasurer to award the certificate. Thank you, Madam.
And that concludes the thematic presentations for the day.
With that, we conclude the thematic presentations and officially break for lunch. Please note that lunch will be provided for all academic staff members, special invitees at the senior common room near the Dean's office. For the students and external authors, lunch will be distributed at the pillared area. Please have your food token with you. We will resume oral presentations at 1:15 p.m.
The QR codes displayed during the breaks allow you to directly download the book of abstracts. Simply scan the code to receive your copy. The following are the venues for the upcoming parallel oral presentation sessions. Session 1A will be held at the Physiology Lecture Theatre, which is this hall. Session 1B will be hosted at the East Lecture Theatre. Session 1C will be hosted at the West Lecture Theatre. Session 1D will be hosted at the Community Medicine Tutorial Room.